From the Toronto Star, I'm Adrian Shung, and this matters. An encore of the first wave, but worse. More than a third of Ontario's seniors' homes have a COVID outbreak at this very moment. The decay of the long-term care system was exposed in the first wave. Nearly 1,900 seniors in long-term care died. Premier Doug Ford vowed to fix it.
And I can assure the people of Ontario that I'm going to move heaven and earth to make sure that we leave no stone unturned, and we're going to fix the system.
But even with a vaccine, doctors and care staff in Ontario are worried that more people will die this time around. We're talking to Dr. Samir Sinha, Director of Geriatrics at Mount Sinai Hospital and the University Health Network in Toronto. How is Ontario failing its seniors again? And what can be done now in the winter months ahead to protect them? Dr. Sinha, thanks for making the time to talk about this.
Thanks for having me, Adrian.
COVID is continuing to spread rapidly in Ontario, and the vaccination rollout here has been slow. And as we're talking right now, in early 2021. What does the situation on the ground look like for elderly patients and residents in long-term care?
Yeah, I think we were hoping that after the first wave that would have been the worst one because it was a dress rehearsal. We were preparing for the worst. We remarkably made it to the summer actually thinking that we can do this. But I think lingering in the back of our minds was the fact that I did a master's in the history of medicine. And I remember studying about pandemics and epidemics and the history of them over 10 years ago at Oxford, and remembering there was one classic line: there's never been a pandemic in human history without a second wave. Yeah, when it started in September and it's just been going and getting worse and worse and worse, you start realizing why these second waves not only do happen, but why they're actually worse than the first. And it's that whole combination of COVID fatigue. It's that aspect that people who learn that they're not really at risk can take more chances. And then sadly, the people who are in the line of fire, like those older people in our society who've represented 96% of the deaths in Ontario, they're the ones who really just continually pay the price, especially when you realize that as a society, we're just ageist. You know, there's so much systemic and societal ageism around it. When you throw all that in the mix, you've actually seen that now, as this pandemic is accelerating right now, you know, we have a record number of homes in outbreak, long-term care homes and retirement homes, over 350 currently. And yes, while we have a vaccine here, it's not really clear when we're actually going to get the older people who are in the line of fire protected in a timely way. Right now, if you ask me how I'm feeling, I'm not really sure. I'm worried and I'm distressed because I think we just have so many more deaths that can occur before we finally see an end to this carnage that's happening.
In terms of the vaccination, Ontario has one of the lowest COVID vaccination rates per capita in Canada right now. The provincial government, of course, the latest news on that front is that they've been criticized by doctors such as yourself for not being aggressive enough about vaccine distribution up to this point. And this week, the province has committed to a deadline, January 21st, to vaccinate all nursing home residents, healthcare workers, personal support workers. Dr. Sinha, what's your reaction to that more definitive timeline? Does it provide any kind of certainty that things could get better on that front?
Not really. And honestly, I was very disappointed because, just let me clarify, Adrian, that deadline that they announced of January 21st, that deadline specifically is for 4 hotspot regions in Ontario. And it's to deal with about 25% of the homes that we have in Ontario, when over a third of our homes, are actually currently in outbreak. So we're talking about making sure that all the residents, the essential family caregivers, the workers are going to be vaccinated by the 21st. And they've originally said that they were going to plan to get all these populations vaccinated by April. And right now, we've got homes throughout southern Ontario that are burning up, that are on fire. We just had another long-term care worker die and one who died the week before. I mean, this is a real emergency. This is urgency. If these were kids who were dying, we would have mobilized an army weeks ago to get these homes vaccinated. And that really what it showed us is while we had a vaccine task force in place, it didn't seem like there was much in the way of planning or thinking of how to do this. Because let me be very clear, other jurisdictions realizing the urgency of where people are dying in our province will realize that 96% of the people who are dying are seniors, that over 72% of the people who are dying are actually those living in long-term care and retirement home settings, and realize that the majority of the healthcare workers that have died to date, and we're about 10 now, I believe, who've died in Ontario, are workers in these settings. But we've now had the vaccine in our province for close to 30 days, and we're now talking about getting maybe 25% of the homes and their residents and staff vaccinated by January 21st, and maybe the rest at some undisclosed date. No. Other jurisdictions have shown well before us that you can take the Pfizer vaccine on the road and get it into these homes. We have the Moderna vaccine. And what really set me off is at the beginning of this week, we had over 100,000 doses in the freezer, and we have 72,500 residents who live across 626 homes. We know where they all are. They're not going anywhere. They're not going to be off on the island of St. Parts 3 weeks from now and miss their second dose. They will be here. We know where they are. They are dying at numbers. We're about to have 3,000 dead. Like, am I the only one who appreciates the sense of urgency? That's why myself and other colleagues are sounding the alarm and saying, let's get this done. I can't stand for this. I don't think it's acceptable. I think we should set the deadline of every resident vaccinated by the 21st, bar none. And then if we fail by a few days, that's okay. But let's set a realistic target that actually matters when people are dying in front of us every day.
So what you're saying is that this provincial government, you do not believe that they are prioritizing geriatric health?
Well, if they prioritize geriatric health, frankly, why would we be leading the country right now in the number of outbreaks we're having in long-term care homes? We've seen the data now. The data is so apparent. Provinces that acted earlier and more decisively have had far fewer outbreaks in their long-term care and retirement homes. Hey, it's a pandemic. We're all learning. Maybe we could argue that some provinces got luckier than others, right? But the fact of the matter is, I've countless seen decisions that have been made where we've looked at the data. For example, let's take our delayed lockdown of 5 days. The government saw the data. The premier saw the data that if you had the lockdown on the 21st versus the 26th, that would actually translate into 10,000 more cases, probably 1,000 people in hospital, and at least 100 people more dead. And you know what? When you're talking about 100 to 200 people dead, we're talking about 180 of those being seniors. But countless decisions have been made over and over where we've actually said the cost of doing business or potentially protecting our economy is frankly a few more dead seniors. And frankly, this government has not come out with a senior strategy. Remember, I developed the first one for Ontario in 2012, the second one in 2017. And this government has failed to come out with a senior strategy. And I think, frankly, they don't have one. And I think their senior strategy is basically let them die. And it really has been morally distressing to me watching decisions after decisions being made. And especially after we learned all the lessons we did in the first wave, and that our premier came out saying, the system is broken. I will move heaven and earth to fix it. We shouldn't have people dying. And what do we see when these homes are burning up in an outbreak? That workers don't know how to use their PPE. That we haven't figured out the staffing issues, where other provinces have figured that out. Saying that we're not having as many deaths as we saw in the first wave is not an excuse to say we're doing better. We've already passed 1,000 people dead in our long-term care homes during the second wave. How is that acceptable? And how is that considered to be better performance than the first wave? Yeah, maybe a few less people dead, but we shouldn't have had all these people dead in the first place.
We'll be right back. There's been a lot of words from Premier Ford. He, in March, said that he was going to create an iron ring around seniors to protect them from COVID.
We will fortify the iron ring of protection around our long-term care residents and those who care for them. We'll go further in our testing, screening, surveillance, targeting the homes facing outbreaks.
Given the first wave, he also promised to create a gold standard of senior care over the next 4 or 5 years. But seeing the reality of what is going on right now, when you see those words, but understanding the reality of care for elderly populations. What does that make you think?
A lot of people are saying right now that, we were promised an iron ring, but frankly, what we ended up getting was an iron sieve. And when we think about this gold standard, again, I almost wonder if we were given some fool's gold, frankly, to play with instead. Again, it's not that this government is guilty. It wasn't this government's fault to start with, but this government inherited decades of neglect around a long-term care system. All governments of all political stripes have owned this file. Frankly, when people aren't clamoring for better long-term care, because we haven't been for decades, it meant that we had a system that was grossly underfunded. Canada as a whole, Ontario included, we spend about 30% less on providing long-term care than the average OECD country, or I always like to say our rich country club, right? So we're a huge underspender. Let's be very clear about that. And that's why when our staffing study, that was created as a result of the Wettlaufer inquiry, basically concluded by the end of the first wave that really Ontario should be providing 4 hours of care a day to meet the current needs of our long-term care residents. And we're currently providing 2 hours and 45 minutes. And then, of course, our government's response was, well, we're going to study the study. And of course, it took our long-term care commission a week before the budget this past fall to say, stop studying the study. Everyone's been demanding this. The hand was forced. And of course, Premier Ford and Minister Fullerton came out, a week before the budget, and they said, we are going to create this gold standard. We are going to commit to 4 hours of care a day. I thought it was amazing. Thank you. And then on budget day, what happened? Do you remember how much money we put towards that commitment in our actual official budget of 2020?
What is that number?
0. And of course, the premier then was asked, but you just made this commitment. It's a pre-budget commitment. Of course, you got a great headline. Dr. Sinha was cheering. Everyone was cheering. So it was great then that, a month later, the premier and our ministers came out and said, okay, so we're going to spend up to $1.9 billion. It's going to be to hire up to 27,000 new workers to reach that 4 hour a day standard. But here's the catch. We're going to do that by 2024-25. And you know what? We're only going to be able to increase care by 15 minutes from 2 hours and 45 towards that gold standard of 4. We're going to get to 3 hours of care by 2022, which is in time for the next election. And most of the current residents in our long-term care homes today will be dead by then. They won't even see the benefit of this. So am I frustrated? Absolutely. You can probably hear it in my voice, because right now, when the government says it takes time to hire people, staffing is not easy. I get that. I'm not going to say that it's absolutely simple and easy to do. But let me give you one thing, Adrian. When Quebec realized that it was very short-staffed, and that was one of the reasons why its long-term care system collapsed, similar to ours, but Quebec had far worse performance than anywhere else in Canada during the first wave, what did the premier announce back in May? We are going to hire an army of new personal support workers. And he realized that the barrier to a lot of people taking this low-paid work is the fact is they have to go through training, and they don't get paid to get training, and the training's expensive. So what did the premier do? Signed up 10,000 people. Number 2, paid them $19 an hour to go through their training and took care of their training for them, and then guaranteed them all jobs that would start September 15th, conveniently in time for the second wave to occur. We had all this evidence in front of us as what it could have been done. BC stabilized the workforce by putting them all on full-time salary and benefits and securing them to enable them to not work in multiple homes. And while Quebec went on a hiring spree, as BC subsequently did too, we didn't do any of that. What we did instead in Ontario was, number 1, is we went around the province announcing building of all these new beds. And number 2, we actually worked on passing legislation that said to all these families who lost loved ones in care, that we put in retroactive legislation that said that you can still sue a home if you want to get justice, but we're going to really say that you have to prove absolutely gross negligence of all these homes. And so we actually raised the standard of the bar so that these homes couldn't be sued under regular circumstances for all those deaths, the close to 3,000 deaths now that have occurred for long-term care. That's what we were working on.
I wanted to quickly touch on a point that you've made previously too, because, these outbreaks, the cases, the consequences, they are not just happening to residents, healthcare workers and personal support workers. They are putting their health and safety on the line as well. We're seeing deaths happen there. And you've spoken out about how it's their employment and the terms of their employment. That is a fundamental problem here. Can you talk about how that is playing into how outbreaks are happening?
Absolutely. So when you actually look at the 100,000 workers who are working in our long-term care homes right now, these are mostly women, and most of them are only employed on a part-time basis, whether they're working as a nurse or a personal support worker, for example. So you can start seeing the problems here, because why are homes generally hiring people more on a part-time basis? Because frankly, it's a way to get more people working for you more cheaply, right? Homes don't save money, if you will, by hiring less staff. They get a certain envelope of funding to actually hire the nurses and personal support workers, and whatever you don't spend, you have to give back to the government. So there's no motivation to profit, but that funding envelope is so small to begin with that all of a sudden you realize that you need to stretch it in any way possible. So hence, this is why operators, both, not-for-profit and for-profit, tend to more likely hire people on a part-time basis. But this is the difference. If you are a full-time unionized worker in Ontario, you're getting about 10 to 14 days of paid sick leave a year. If you are a part-time unionized worker in Ontario, you're getting about 1 to 3 days of paid sick days a year. Remember, these people could also go work in a publicly funded hospital system where, by the way, you're going to make way more an hour working in those environments than you would in these environments. So now you start realizing why 80% of the homes in Ontario prior to the pandemic were having trouble recruiting and retaining staff. Because first of all, we pay them less. Their benefits aren't that great, especially when most of them are hired on a part-time basis. And then finally, when you're hiring only a handful of people to do the job of many, you start burning through your staff like nobody's business because people are tired.
The burnout is real.
They burn out real. And this is why you actually see the average lifespan of a worker in these settings is just over a year and a half. So then you realize that if we don't deal with the staffing issues in a regular day, then how are we going to actually survive a pandemic? All of a sudden, you end up having workers who are tired, who are exhausted, who frankly, we've actually created a moral hazard where when you don't really have good sick benefits, for example, and your decision is stay home if you have some symptoms, but don't get paid, or come into work and hope to God you don't have COVID and hope to God you don't have anybody getting sick. This is the reason why so many cases of COVID are coming into these homes, because largely we have a marginalized workforce that we're not really giving them much in the way of options to protect themselves and to protect their pay.
Obviously, through this conversation, there's a lot of points here that we should be worried about. That is concerning. In your mind, what worries you the most about the situation at long-term care homes, about our elderly citizens over the next 3 to 4 months through this winter and spring?
What worries me the most is, I think, systematically, again, this government doesn't have a senior strategy. I don't think this is a government that truly has come to value older people. I just really feel that we've had a government that's been motivated more on the basis of trying to protect businesses rather than trying to save lives. And so what worries me the most is we know what we need to do right now, here and now, to finally end the carnage. We can fix the staffing issue. Like, there are ways to do it. Other provinces have showed us what to do. We just have to do it. And apparently, we'll move heaven and earth. Our premier said that. There is no shortage of money. We can do this. So why don't we do it? It just sends me a message that, frankly, we don't really care about these people as much as maybe you do, Dr. Sinha. And you need to be okay with that. And you know what? I'm not okay with that. And I don't think most older Ontarians or the families of those living in long-term care are okay with that. And that's why I'm happy to say what I'm saying right now, because it needs to be said. And I think, frankly, a society is valued on the basis of how it treats its most vulnerable people. For anybody listening who says, yeah, whatever, here's the thing. All of us are probably going to make it beyond 65. All of us one day might need to rely or have a loved one rely on our long-term care system that we have all contributed towards making as bad as we have now. If we don't change it for the better now, and if the 3,000 people who've died have not told us that we need to fix this broken system and take it seriously, then I don't know whatever will change things for the better. So that's what I'm most worried about, is that, frankly, I'm seeing people die before my eyes every day, and that we could have prevented these deaths. We could have prevented many of these deaths in Ontario. And I don't know if there will ever truly be a reckoning, because as a society, we've never really truly given, much care about our older people versus our children. We are fundamentally ageist. If there's anything that I want to remind those politicians about, because I've learned over the years that the number one job of a politician, whether they be the premier or the minister of health, is that they want to get reelected. That's their number one priority, I've learned over the last number of years. And you know what? Here's a fun fact for you. Do you know which is the most active voting population in our province?
It's our elders.
It's our elders. And you know what? They don't forget. So 80% of them vote. So you know what? Anybody who wants to get reelected, realize that you're now going to deal with 3,500,000 seniors who aren't terribly impressed, I'm sure, with our record around COVID. And frankly, are going to want answers and want to see action that we really do care. Because frankly, when you look at our record to date, it hasn't been very good when 96% of the people who've died have been seniors, and the vast majority of them in a system that we've allowed to suffer from ongoing neglect during this pandemic.
Dr. Sinha, thank you for your time.
Thank you.
That is Dr. Samir Sinha, Director of Geriatrics at Mount Sinai Hospital and the University Health Network in Toronto. In 2012, he was appointed by the Ontario government as the expert lead on the province's senior strategy. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Chung, Saba Aitazaz, and Raju Mutar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.